I'm Dr. Alex Dunn, and this is my full protocol and approach that I take with each and every client to keep them in the gym, lifting, pain free for the long haul. So, first thing we're going to go over is exactly what I do to assess each and every client. We're going to talk about the skill acquisition and biomechanics phase, which is very, very important to restore mechanics at the foot so the rest of the chain can do its job. Then we're going to talk about how do you actually build Achilles resilience via load progressions. Then lastly, most importantly, prevention, maintenance for longevity, keeping you moving for the long haul. A big piece of what I do is the longevity factor because I believe in training and doing things for a long time, not just next month. So the goal here with this entire Achilles revival protocol is not to just fix your pain, because if you're here, you've probably dealt with pain for multiple months, maybe years, and you've done a bunch of calf raises, you've done the stretches, you've been to other PTs that gave you those cookie cutter exercises. So, what they didn't do is really these first two phases, and they probably didn't do this as well as they could to get you back to running, lifting, playing sports like you want to do. So this exact protocol is what I approach with each client. Each client is different, so it is tailored. However, these are the 4 steps that we got to go through to be successful. So step one, 12-point movement assessment. This is one that I created. It's very simple from a movement perspective. It's important to look at all these in a very dynamic way. And basically, we want to understand what is actually happening from the ground up. So the movements I do are pretty basic. The way I break it down is not. Jump on a call for 45, 50, sometimes 60 minutes with new clients just to break down their movement patterns. So that way I can build the first part of their program in point number 2 here. So the 6 main movements are squat, lunge, hinge, gait or walking, spine rotation, and then a single leg heel raise, right? Pretty straightforward. However, I break it down, slow it down frame by frame. That way I can see exactly what's happening, especially at the foot. So is the foot able to achieve proper pronation, supination in the right sequence? What's happening with the pressures in the foot during an RDL, during a squat? How are you walking as a whole, right? Where is your heel striking? Are you loading through the midfoot? Are you pushing off that big toe? So all these are important and really play into how I want to go begin programming for that specific client. So you may be wondering, well, is this for me, right? I have high arches or I have flat feet. Yes, these are normal anatomical variants, right? They're not meant to be scorned. They're meant to be a normal variant that we need to apply to your programming. So if you have more flatter arches, you're probably dealing with some form of instability through that midfoot or the mid-tarsal joint, proximal transverse arch. And that's where we need to improve stability at the midfoot. So when you do pronate, you have it under control and you can transfer that load through the foot and up the rest of the body. Because if you're overpronating or collapsing through the midfoot, what's going to happen is you're probably not going to push off that big toe as much. What has to happen as a result is you got to get that push from somewhere. Your Achilles is going to take the load. So that's why this assessment is important, so I can assess what is happening at the foot and how we're going to treat the rest of the body. So again, this is how solid is your foundation, right? And from there, once we know what we got to drill first, we go right down to this skill acquisition and biomechanical phase, basically moving your body with intention or with intent, right? So I look at this again from the ground up: foot, ankle, knee, and hips, right? There's certain sequences with certain movements to make these optimal, which your body does pretty good naturally. With compensation patterns, this could be affected a little bit. And that's where we need to uh, re-engage the biomechanical nature at each point, right? What are they supposed to be doing? What can we maybe get them doing better? And then it's about connecting it, right? How can we get the foot to do its job so the knee can do its job, so the hips can do its job, right? That way we can redistribute the load a little bit better all the way up the chain, which is not only going to help you rehab the Achilles, but it's going to help just clean up your movement patterns as a whole. Okay. So moving your body with intention, very, very important here. This is kind of the backbone of what I do in my process. It's a lot of heavy cueing to be sure that things are moving the way they're supposed to be moving as we start to increase load. Load necessary. We need load to heal the Achilles, right? So we need to get it to a place where we can distribute the load appropriately. And then we need to build true strength with actual load, not just body weight calf raises, not just 3 sets of 15 3 times a day. We need to put it under actual load in a lengthened position. Now, we don't just shove you straight into a really deep dorsiflexion position with heavy loads because it's going to piss the Achilles off, more than likely. So we need to get there gradual. So I usually start like with a isometric with the heel parallel with the floor to create some tension on the Achilles without getting to a point where it's just overloading, right? So actual load, right? This is more towards like the middle and end of rehab when we're really good and pain free and we're starting to like push that load quite a bit. That's when we can load you up on the bar, load you up with some dumbbells, kettlebells, whatever you have available, and make sure that you're getting to these lengthened positions at the tendon to create true tendon deformation over time. Changing the tissues at the tendon takes a long time. So it's about getting them in this process of loading in this lengthened position. That way, when you're back running and playing sports and basketball and pickleball, you're able to actually get into that position and out of it and allow that tendon to be springy, strong, and resilient. So load is key here. Okay. Now, increase load, we increase tissue adaptation, right? The tissue learns, it learns like, okay, this position is fine. The collagen fibers are getting a little more adaptive to the positions that you're putting them in. And that's where true tissue deformation happens over time. So, increasing the load over time progressively in different ranges is important. Now, to get back to more athletic stuff, we got to load a little bit differently, right? We can't just do static holds and eccentrics. We need to get into some plyometrics to get some more athleticism. The tendon is a viscoelastic structure, okay? It means it really loves to stretch. It really loves to contract at a fast pace, right? It needs to be fluid as it does it. So, plyometrics are great to train that stretch and shortening cycle that happens with the Achilles because the Achilles is under a lot of tension anyway. So we need to teach it to do its job a little bit better. Again, got to be able to load it so we can get some tendon adaptation, tissue adaptation, and then we got to be able to connect it with the rest of the body. So that way we're not just shoving everything into the Achilles, right? We have good midfoot stability. We are able to accept some force through that midfoot. That way the tendon can be nice and springy and explosive like it's supposed to. So with plyometrics, we increase athleticism, overall decrease risk of injury. Okay. We can't prevent all injuries. It is not possible. However, we want to radically decrease the chance that you do get an injury, especially once you go and start running and playing basketball and pushing the limits a little bit. But we got to get to this first. Okay. Uh, all this time, I have my athletes continue to do the stuff they're doing, running, lifting, playing ball, if they're able to, right, within their tolerance. So we don't want to get rid of that, right? But we need to supplement it with the right style of training, depending on what they're wanting to get into. The last piece here, prevention and maintenance for longevity. We're going to do this, all this work to get this tendon in a good spot. We need to make sure that it sticks. Longevity is key. It's not about doing this for 1, 2, 3 months or even a year. It's about doing this for years to come. So longevity is big for me. It's getting the right plan in place for that specific person. Like, okay, if you're going to lift 4 days a week and run 2 days a week, these are the exercises you need to do to make sure that this thing just doesn't come back. And if it does kind of flare on you, you know exactly how to approach it. So again, how does it fit into your routine? You can't just do 15 different exercises for the Achilles every single week. It's going to drive you crazy. You need the right ones. They're going to feel like a workout. So they fit into your workout, right? Not just easy body weight calf raises. It's not going to do it. So how does it fit into your routine? Where does it need to be plugged in during the week so you can stay consistent? And that way it just carries over to exactly the things you want to be doing. So big thing for me, efficiency, effectiveness over everything, right? Not a bunch of fluff, targeted stuff that makes sense for your body, for your goals. So that's my 4-step approach when it comes to reviving an Achilles, especially with Achilles tendinopathy, or if you had an Achilles rupture in the past and it just hasn't gotten to where it wants to be, dealing with a lot of weakness and pain. There's obviously some compensations that are happening in the process that's keeping you stuck. So if you feel like you're stuck and you haven't been through something like this in the past, where someone's actually taken a look at your movements, reapply the biomechanics that are needed, and then build true strength, get actual load, not just body weight calf raises, not just stretches, but then actual load through that tendon so it can heal and be strong. And then at the end of it, a plan so it doesn't come back. So this is how I approach each and every client that I work with. This has been successful for many different cases: competitive power lifters, ultra marathoners, obstacle course runners, basketball players, professional basketball players, uh, Olympic athletes. I'm working with a guy who's on the Team USA bobsled skeleton team. Dealt with some lower body stuff in the past. He ran competitively overseas professionally. And this approach has been crucial for me and my clients to help them reconnect better with their feet. That way they can do the stuff they want to do with a better, stronger foundation for longevity's sake. So if that sounds like something you're interested in, feel free to book a call down below. I'd be happy to chat with you further. Uh, really just see if it's a good fit and if this makes sense and if I can actually help you. If so, I'll show you what that looks like, run you through strategy for your specific case. However, appreciate you joining me in this video. See you in the next one.